Okay, right, let's make a start. Good afternoon, everybody. Welcome to our monthly Community Mental Health Transformation webinar. I'm Megan G, and I'm the Communications Manager supporting the programme across Sussex. And today we're going to be heading over to West Sussex to really give you all an opportunity to be able to ask kind of any questions that you've got about the developments of the neighbourhood mental health teams in West Sussex. And I'm joined by both Amanda Walderman and Robert Zamansky today, and they'll introduce themselves in a moment once we've done some housekeeping. But just to start off with, just a couple of points just to make sure we're all nice and settled and comfortable. So the session is being recorded today. So as we just mentioned, you do have the option of having your camera on if you'd like to, but equally, please don't feel obliged or pressured to. The option's just there, and obviously you're very welcome. But because the session is being recorded, if you did want to anonymise your name, please feel comfortable to do so. We just want everybody to be able to participate in the way that feels best for you. The session, once it's been recorded, will get uploaded to our YouTube channel that we've got, and we've got a lovely collection of webinars now, as we've been running these since the end of 2022. So it'll be added to that YouTube playlist. So if there are previous sessions that you've missed that you want to watch back, you can access them there. And as I say, our session today is going to predominantly be the opportunity for you to be able to ask any questions. So there's a few ways that you can do that. You can put your questions in the chat, and I'll be keeping an eye on that. Or we've also got a Q&A box, and you can put your questions directly in there. Or if you want to, you can raise your hand and we'll come to you and you can ask your questions to the panel directly. So lots of options, so you can choose what feels best for you this morning. And then lastly, after the session today, I'll send around a recording of the webinar as well as a copy of all the slides. And within that email, there'll be a link to a very short survey. And if you have just a couple of minutes, we really appreciate if you can complete the survey. It just really helps us to check that the session was kind of valuable and anything that you would like for us to consider or include in future sessions. So thank you for taking the time to do that. And as I say, we have got quite a batch of webinars that you can watch back, which can be found on the QR code. This will be included in the slides that I share with you, so don't feel like you've got to scan it now. Okay, and then just a couple of bits kind of like news and updates to share with you kind of from an overall programme, so not just specific to West Sussex. But if you joined the session last month, you would have heard me speaking about an upcoming campaign that was going to be launching in the coming weeks. And I just wanted to kind of share with you all that the campaign is now live. Little preview of it on the screen now. So this is a campaign that's been developed by partners across Sussex, and as well as people with lived experience of accessing services, families, carers, and is really a kind of collaborative piece of work. And the aim of the campaign is to really raise awareness about the information and support that is available for people across Sussex if they do need support for their mental health. The campaign launched on the 10th of December, and it's going to run all throughout the festive period until the 12th of January. So you might have seen some of these kind of images popping up kind of on like screensavers where you work, or posters or bits on social media. So it's just kind of a bit of an ask of everyone joining today that if you do see it, just help us to kind of spread the word, share it with anyone who you think it might be kind of interest to, as we really want kind of as many people as possible to see it. So thank you for doing that in advance. And then just a couple of kind of updates from the programme. So as we mentioned in last month's webinar, there's been a piece of work kind of ongoing to develop kind of a range of communications to a number of different groups of people, just to kind of give them a bit of an update as to where we are in the development of the neighbourhood mental health teams, and kind of give a bit more clarity around kind of timeframes as to when people can start to see some of these things coming into place. So just to say that that work continues. So again, you might start to see kind of posters popping up where you work. you might start kind of receiving, letters or information packs if you work within the team. So just to say that kind of continues, just to try and help people feel kind of as well informed as possible at this stage in the programme. And then just to kind of flag that an interim standard operating procedure has been developed. And basically what this is just to kind of clarify the kind of policies and procedures that we're asking kind of our colleagues and teams to be working to. And this is just kind of like a holding statement, which basically in the simplest terms says that obviously we'll continue to be using the service kind of operating procedures that we have already. And there's a piece of work underway to develop one that will be specifically for the new neighbourhood mental health teams. So if anyone does want any more information about that or to see a copy of the interim SOP, then do obviously let us know, and we're happy to share that with you. And then lastly, just to say that work continues for us to set up and establish these new meeting structures that we've described in previous sessions. And this is just really kind of bringing together colleagues and teams that are going to be part of the neighbourhood mental health team to make sure they're in the meetings they need to be in, so that real kind of collaborative working can start to happen in a really seamless way. So that's just still continuing. So that's kind of it in terms of updates from me. And as you'll be familiar with by now, there's lots of different ways that you can kind of stay up to date with how things are going in the programme. So obviously we've got these sessions, which you know about as you are here. So that's good. We've also got a monthly newsletter. So if you aren't already subscribed to that, please do get yourself signed up, as that gives kind of a really nice overview of everything that's been happening that month. And so we've got all of our previous webinars that you can watch back. And then we've also got our VCSE Mental Health Network, which is a Sussex-wide network. So if you work for a voluntary sector organisation, we'd really encourage you signing up to that, as that's a really good place to really kind of stay informed about the developments within the community transformation. And then we've also got kind of a web page that has all of the latest news and resources, which we're adding to all the time. So it's quite a handy place to reference and direct people to if they want to know more about the work that's underway. And then lastly, you can always email us. So if you have any questions or thoughts or things that you want to be kind of able to get involved with, do drop us a line and we'll always come back to you. So yeah, that mailbox is always open. Okay, that's it from me in terms of my housekeeping. I'd now like to introduce Amanda and Rob. If you'd like to introduce yourselves to the group. Thank you.
Hello, I'm Amanda Walderman. I'm the Senior Manager in the commissioning team, working in adults mental health for West Sussex.
Thanks, Amanda. And Rob.
Hi, I'm Rob or Robert. I don't mind. Either way, I'm the Managing Director for the West Sussex Adult Division in Sussex Partnership Trust. Hi, everyone. I think I saw some of you at the last webinar in West Sussex as well. I also wanted just to mention that today we have Amanda and I fronting the webinar, but we recognize it's a partnership working, and sadly, due to ill health or sickness, we don't have a voluntary care sector partner joining and fronting the webinar today. But I just wanted to recognize that it is a partnership working, and we would normally have a lead from voluntary organization. It's just today, due to sickness, they were unable to join. But I hope they get better soon, in time for Christmas.
Thanks, Rob, and thanks, Amanda. And yeah, so we're now going to come to our kind of main portion of the session, which is over to all of you. So kind of any questions that you have about kind of the work that's underway in West Sussex to roll out neighbourhood mental health teams. Yeah, so any kind of questions or thoughts that you have, we're all here today to be able to respond to those questions. So say lots of ways you can do that. You can pop it in the Q&A box, you can raise your hand, you can pop comments in the chat. We'll be keeping an eye on all of those. So yeah, it's over to you. This is the bit that's always a bit nerve-wracking because no one wants to be first. Um, but this is we're friendly. This is a safe space. So yeah, please feel comfortable to ask any questions that you've got today.
Can we just butt in? We've got our hand up.
Oh, sorry, Mel. Well, you haven't got your camera on. I can't see your hand.
Oh, yeah, I have.
Oh,
Well,
I can't
well,
see
I'm
you.
here. One thing I was wondering is the rolling out of the survey. Is this the thing we were talking about with the EBEs, using them as their experience?
Rolling out of this, did you say survey?
Yeah.
So the survey that I mentioned at the beginning of the session.
Yes.
Oh, so that's just a short survey to gather feedback about the webinar itself. So in terms of kind of how helpful it was, or kind of other topics that you'd like us to cover in the future.
No, that's perfect. That would be an excellent thing to. I've got Elaine on, and she's very happy to hear from us on this, on what we can put to them to be able to gather information for us. So we'd be getting it in a less, formal, structured, meeting kind of way. It would be much better for them. They'd get a much more amenable reaction, and we'd hear a lot more inside information rather than what people feel they should be saying. And my only other question is if there's a magic link we can send our GPs, that would be superb, because from experience with sending out a link for SPT, and then I'm also doing a bit of ICS work, and sending out a link for that, it's much softer and it's very, very warmly received. So that's just if there's a chance we can do it, then that would be great. It's more of a begging line, not a question. But
thank you, Mel. As I say,
you.
no, that's really, really helpful. As I say, the survey that I'll share with you all after the session today is specific to the webinar, but it's also worth noting that there is a piece of work underway where we're developing and kind of looking at kind of evaluation, like metrics, if you like. So how, once the neighbourhood mental health teams are rolled out, how we can then monitor what people's experience is like. So both thinking about people accessing services, but also staff working within those teams. So that will be something that we'll be able to share kind of in a future session.
That's where you're getting great conglomeration of actually EBEs and staff having total thorough agreement. And it's not being said for effect. They really are seeing the changes that are being made and the agreement of the outcomes. And so it's something worth getting into you, rather than just having it said and reported. It's actual truth of the matter.
Thank you, Mel. That's really good to hear. And just kind of in response to your point about obviously wanting to really engage with our primary care colleagues, we have been doing kind of a piece of work to make sure that we are obviously sharing information with our primary care colleagues, but equally making sure that that is a conversation, so that they know obviously how they can be kind of engaging with us, making sure we're looping them into those meetings that are being established, so that they feel really well informed about the work that's underway too. So thank you very much for those points. We have got a question here in the chat. Sharon has asked, how many neighbourhood mental health team meetings have happened kind of so far? And how many patients have been triaged through them? So I'll put that question to Rob and Amanda if you'd like to come in.
Hi, thanks Megan, and thanks Sharon, and it's really great that you're really interested in the progress of the neighbourhood mental health team meetings, and how they're being established. As you're probably aware, officially our neighbourhood mental health teams came together only recently, around the end of October, beginning of November. The teams are just starting to collaborate further, building on the previous frameworks, because there's a number of different triage meetings or multi-agency meetings already happening, so they're just building up on this. And I'm sorry I can't provide you the specific numbers at this time, but I am generally optimistic about the potential and the positive outcomes and improvements that working together as a neighbourhood mental health team, we neighbourhood mental health teams will bring to local people, local communities. I think building on your question as well, I think there is something for us to understand as part of the development work around the reporting structures of this. I wonder whether, Amanda, we need to bring to our working and project group meeting, how do we actually capture that so we could be transparent and open about sharing the information with wider communities while maintaining confidentiality of patients as well and service users. So that's something for us to take away. I'm sorry, Sharon, I can't give you the detailed numbers now.
Thank you, Rob. That's really helpful. We've started getting a flurry of questions in, so this is brilliant. So we've got a question here from Fiona, who's asked about the specialist pathways that we've got kind of as part of the Community Transformation Programme. So Fiona said one of the 3 specialist areas of focus is going to be a complex emotional needs or CEN pathway. Can we explain a bit more kind of what our kind of hopes and ambitions are for the specialist pathway? For example, for eating disorders, the hope is to develop an AEEDS, which I'm afraid I don't know what that means. But obviously we do have kind of 3 specialist pathways within the community programme. So as you say, one for complex emotional needs, one for community rehabilitation service, and another for eating disorders. So Amanda and Rob, would you mind speaking a little bit about kind of what our ambitions are for having those identified specialist pathways and how they kind of work with the development of neighbourhood teams?
I'll kick off, Amanda, unless you want to kick off. So as Megan, and thanks for the question as well. As you know, and as Megan explained, the community neighbourhood mental health teams at the moment focus on working age adults, and they will link with specialist pathways like all age adult eating disorders, community rehab, and complex emotional needs. And in fact, we're doing some work across West Sussex also as around multiple disadvantage needs groups. Those pathways will be developed to sit alongside the core group or core services, core offer within neighbourhood teams, with straight referrals and handoffs process signposting to those more specialist services to some extent as it sits currently. But I do hope that through the daily triage meetings or regular triage meetings and MDT working, we'll be able to reach out to those services and specialist support more timely and in a more responsive manner than what it is now. So I see those pathways to be more aligned to the core neighbourhood team offer, rather than sort of being the part of the core neighbourhood team offer for the priority of the neighbourhood mental health teams. Amanda, would you add anything else, or have I misrepresented anything?
No, I wouldn't. I don't really have much more to add to that, but I do know that we have had a webinar on complex emotional needs and rehab pathways. So it might be worth going back on the QR code that Megan showed earlier and having a look at those webinars, because they are separate pieces of work. So yeah, and I know that eating disorders is actually on our agenda to be discussed at a meeting that I'm going to in January. So yeah, I don't have much more of an update than Rob already gave.
Thank you both. As I say, I'll share around the link to the YouTube playlist, and I'll also just kind of highlight where the ones are around the specialist pathways, so you can find them quite easily. As yeah, it'd be helpful to kind of watch those back and see kind of what the original ambition was when we kind of set out on that piece of work. So thank you. We've got a question here from Carol, who has asked, will the Pathfinder model be replaced by the new neighbourhood mental health team model? Some kind of clarity around that, please.
Yeah, do you want me to answer, Rob, and you could add in what you think? It's a tricky one to explain because nothing is being replaced. Everything will still exist. It's just that it will all be working in a much more closely aligned way. So Pathfinder will still be in the NMHT. It's just that we won't be calling it Pathfinder. We won't be calling emotional wellbeing service. We'll be calling it the neighbourhood mental health team. So if you think of it as a team of specialists, all with their different skills and experiences to offer, you will be referred to a team and you will find your way to the right specialist. So Pathfinder isn't being replaced, but it will be part of the new neighbourhood mental health team, if that makes sense.
I think, sorry, thank you, Amanda, and thanks for the question, Carol. I think it's worth to recognise that some of the changes or transformation or evolution into the neighbourhood mental health teams may mean that some may feel like maybe some services are disappearing, but I just wanted to provide the assurance it's absolutely not the intention. It's just a slightly different way of working by bringing all the local core local services together. And while with time we may not be referring specifically to a Pathfinder service or assessment and treatment service, actually all those functions will continue to exist as part of the neighbourhood mental health team. But I also understand, I think, how it can create a bit of a worry and questions, and I wonder whether that's the reason for your question as well. I think we do need to make sure that we clarify that even more in more detail through our communications material, and I know, Megan, that you're working on this.
Thank you both for responding to that question. There's kind of a similar theme for the next question, which is around I guess kind of the services and teams that are going to be part of the neighbourhood mental health teams. So as we've spoken about Pathfinder, but there's also a couple of questions here around, will the assessment and treatment service, so the ATSs as they're known across Sussex, are they part of the new neighbourhood mental health team model as well? And there's also a question here around drug and alcohol services being included in the neighbourhood mental health team. So are we able to speak a little bit around kind of the core team and then the aligned services that we're starting to obviously identify? Thank you both.
So I'll just quickly kick off with the ATS element as well. So absolutely, the current assessment and treatment services, which are effectively community teams provided by Sussex Partnership, will be part of the neighbourhood mental health team. I would like to stress the point they will be part of the neighbourhood mental health team. They are not taking over the neighbourhood mental health team. It's a neighbourhood mental health team consists of ATS, of the Pathfinder function, and of other core teams and voluntary care sector support services. So it's not absolutely takeover, but they will be part of that service. In terms of the core team, Amanda, are you okay to give an update in terms of what we see as a core team and then what the services are aligned? Is that okay?
Yes, of course. So the core team, as Rob said, is the SPFT, Sussex Partnership Foundation Trust. It's their ATS assessment and treatment service. It also includes our emotional wellbeing service, which is the service that's in all PCNs. It will also include Pathfinder, our IPS service, our screen and intervene service. So there's lots of access facilitators. There's lots of like those core mental health services that will be in the neighbourhood mental health team. Outside of the core, we have our aligned services, and I guess the most closely aligned will be our talking therapies. So our talking therapy services will be very closely aligned. The reason that they're not included in the core team is to do with how they record data and how they record their information. So everybody in the core team will have a electronic patient record that they can share, whereas those in the aligned services won't be able to share that way of recording information. So the aligned services will be services such as substance misuse, support services, housing, maybe systems advice, debt debt services, services that are really closely aligned to and often referred to by mental health services. So they will be in the aligned services, and then we'll have our wider network, which is like the more specialist services, maybe things like bereavement support or domestic abuse services, who will also be in the wider network. And so how it will work is we have our core team will be having daily, weekly, monthly meetings where they work together, and then the aligned services can either request to be a part of that, or we can ask the aligned services to come in and support the work that the core team are doing. So that's how it will work moving forward. At the moment, we're just starting conversations with aligned services. We've not really started that piece of work yet. We were just getting the core team in place, working together. The core team have got a list of, they have 4 or 5 meetings that they need to have in place, and all neighbourhood mental health teams have got the first 2 in place, which is a daily huddle and a weekly team meeting. So those meetings are happening, and the multi-agency triage, for want of a better word, where the teams come together in that way, they're already happening across Sussex. I think off the top of my head, 5 of the 7 neighbourhood teams, that is working well. In the other 2, it's still happening. It's just not as streamlined and clear as in the other 5. So yeah, we're definitely making progress with that. Multidisciplinary team working is definitely starting to happen in West Sussex.
If I can just add one more thing, Megan. So in terms of thanks, Amanda, for clarifying the core teams and aligned services. I think what we try to do across Sussex, and certainly across West Sussex as well, to make sure that there is a consistency in terms of the core team for each of the 7 neighbourhood mental health teams. And there is some consistency in terms of aligned services as well. My personal vision for the neighbourhood mental health teams is that as they emerge, as they embed, that what aligned services may differ slightly between the teams, but that could be for a very good reason. Could be potentially because in one locality there's a need for more specific service that responds to the needs of that particular locality, whether it's a substance misuse or whether it's maybe something focused on older people. So I think I just wanted to say that the core team is consistent across. We know that some of the aligned services will be consistent across all of the teams as well, e.g. time to talk, but some of the other ones I would like, my personal vision is for the neighbourhood mental health teams to really work with local communities to see what other services need to be aligned to respond to the need of that local population, local community.
May I just reply to Robert? Because Robert, you've said exactly what is being noted through people participation, but it's also very noticed in the ICB meetings that I go to. It's not something that is, oh God, we've got to push that one forwards. That is really being strongly noticed, and different age brackets with different conditions, be they physical or mental, all merging together. It's highly noted. So it's not one we need to panic about too much just yet.
Thank you.
Thank you, Mel. We've got another question here from Amy, who's been asking around, will carers support be part of the aligned services to support families and friend carers? Amanda and Rob, I don't know if you're able to respond to that, please.
Yes, we hope that basically anyone who wants to can be involved in neighbourhood mental health teams if there's a reason and if there's a need. Then it's a very welcoming environment where we can all work together and support each other, and absolutely carers are definitely part of that. So the aligned services would include carers.
Absolutely, I'd support that as well, and I think that's the we know that the patients and the people that will be getting support from our neighbourhood mental health teams or that the neighbourhood mental health will support, these are not just people who need support under mental health, but actually they're their relatives, they're their friends, they're their carers, and we can holistically support them and improve their lives without that care support. So from my perspective, yes, absolutely. And again, I think we know that sometimes there is a bit of variation at this stage, what that care support looks like across different places in Sussex and in West Sussex. But that'll be my ambition. And as Amanda said, I think that's sort of our shared ambition to have that care support as part of the neighbourhood mental health teams.
Thank you both. That's great. We've got a question here from Lucy, who has described that at the moment it can be quite challenging to find out information about services that are available and to be able to help people that you're supporting and working with to be able to access those services. So Lucy has asked, will there be better links and contact points for professionals in terms of how they can contact their neighbourhood mental health team? So kind of clear, you know, either a duty number or telephone number or email address, as the experience at the moment is that it can be quite challenging and sometimes messages aren't responded to, which can then obviously put additional pressure on that individual having to kind of chase up for a response. So I wonder if we can speak a little bit about kind of what our ambition is in terms of how we hope to improve that and make it easier for obviously colleagues working across the system to be able to access that information and support.
Thanks for your question, Lucy. I think it's fair to say that at the moment the Sussex Partnership ATS teams have consistent sort of entry points. I think we're just working through the process of establishing a consistent email address or a referral point or a contact number for each of the neighbourhood mental health teams to make sure that the requests, I don't want to necessarily call them referrals, but the requests are being triaged, looked at accordingly. We're not there yet, but I'd like us to be able to say in the next few weeks or months that actually each neighbourhood team, which is not necessarily SPFT, but each neighbourhood mental health team has got a dedicated point of contact, and here's the email address, here's the number, hopefully the number you can call. I think that's the ambition. Again, Amanda may correct me, but hopefully I didn't say anything that's wrong, but that's how I would say it. Lucy, I also note you raising some points which I wonder relate very specifically to some of the current Sussex Partnership ATS queries. I'm just making a massive assumption here. If they are, can you reach out to me outside of the call? My contact details are probably on the webinar, and we can see what we can do. Our neighbourhood mental health teams at the moment are focusing on around working age adults, but we know that our service users, carers obviously look after children. We also know that children become adults, so it's important we make those connections.
Thank you, Rob. That's great. And Lucy just wanted and said that thank you. That will be so much better, and that they'll be in touch with you. So that's great. Amanda, did you want to add anything?
Yeah, and I was just going to say it was a bit of a chicken and egg one. We didn't want to set up a central contact number until we have the core team in place, because you would contact and it wouldn't be there. So we had to set up the core team first, and we're working on the best ways to contact it. But what will happen at the moment is if anybody gets a query, a contact, a referral that's not for that service, they can quite easily now just take that to an MDT meeting and make sure it gets to the right place, or find out where the right place is and contact the service user or patient with that information. So at the moment, referrals and queries can come in at any point, and hopefully with the MDTs they will get to where they need to be. So we're trying to take away the need for everybody to know everything about how to get where and what's available. We're trying to remove that need so that we can just, anything that comes in, we can, as a neighbourhood mental health team, we can make sure it gets to the right place without just sending it back and then them having to try somewhere else. So that's how it should be working.
Thank you, Amanda, for that clarity, and thank you, Rob, as well. We've got a question here from Pat, who's asking around how we intend to kind of reach and work with people who have got a severe mental illness, or SMI, as it's widely known. So how do we, as part of the neighbourhood teams, how do we intend to obviously engage with this particular group and work with them to help obviously help them to have, you know, kind of an improved quality of life? Are you able to respond to that point, please?
So our existing ATS services, which will form part of the neighbourhood mental health teams, they already support people with severe mental illness or SMI, Pat, as you absolutely explained that. I do hope that by coming together as part of the wider neighbourhood mental health team, whether other sectors, voluntary care sector, Time to Talk, and services like that, will be able to identify any additional patients that may need a more immediate and more specialist support from the secondary care type element of the mental health of the neighbourhood mental health team. So I think there will be what the neighbourhood mental health team will bring, in my view, is the proactivity. So when a referral or a request for someone to be supported by the neighbourhood mental health comes in, through the triage and open discussion, we'll be able to identify the right person or the right service to provide that support. And if it's someone who needs support around the SMI, this is where the assessment treatment part of the neighbourhood team can do the intervention while working alongside other core members or aligned services. So that's how I would see it. And absolutely, our current ATS services, who will be part of the neighbourhood team, will be picking that up. Plus the function of the EWS Pathfinder Access Facilitator will continue to exist within the neighbourhood mental health team, and they'll be able to highlight those patients as well. Well, not necessarily patients, but, you know, people who will be able to, people who need the support around the SMI. Amanda, anything to add?
Thank you, Rob.
No, nothing really, but it's just reminded me of a really interesting presentation I saw. It was from, if anybody wants to look it up, Plymouth University have been researching community mental health transformation, because it's a national programme, it's not just Sussex. And there was a discussion that one of the professors gave where they'd tracked a patient referral coming in, and the referral had gone, had been passed on and sent back and moved on, and a appointment had been sent to the wrong address, and then the phone number didn't work, and then it was passed on. And they were basically saying, you know, there were 7 or 8 interactions taking up 4 to 5 hours of professionals' time. The patient had not had even a contact, never mind treatment or support. Nothing had happened with that patient. And what we're really hoping is that stops, and now what will happen is those hours can be spent on patient care and providing holistic support, rather than all those hours on admin and chasing and, you know, going around the houses looking for ways to give people appointments. You know, we're just hoping that by us all working together like this, it will really cut down on the time wasted and increase the time spent with patients, so that we can really offer holistic support, and people can, you know, go to the MDT meetings and say, you know, I'm working on this bit, but they really need a hobby, or they're really lonely, or they really need some sort of support in their education or employment, and then everybody can get together to provide that support, rather than, you know, wasting time on admin procedures that are not working at the moment.
Thank you, Amanda. Yeah, that's definitely the ambition, isn't it? To just try and make it more straightforward, so that people will just start receiving support, and not it having to be, you know, really, really challenging to be able to kind of get to the right place, you know, to actually be able to start that support. So thank you. That's really, really helpful. Sharon's asked a question here around kind of how the neighbourhood mental health teams are going to engage and kind of link in with our inpatient services and with crisis services, and yeah, kind of how that connectivity will work in terms of kind of the, you know, the pathways of support. I wonder, Rob, did you want to respond to that one?
So in terms of the more specialist or responding in or supporting inpatient care, our existing ATSs, or part of the neighbourhood mental health teams, the lead practitioners already take an active part, or should be taking an active part, in a discharge planning for whoever's admitted to a unit and is being to a ward and is being discharged into the community, to make sure there's that continuity of care and support, and that's done and it should be done in partnership with local authority or social workers, key workers, as required. So that already happens. My expectation is that our crisis resolution and home treatment teams will be part of the triage meetings and will be able to either refer or indeed support people in the crisis, because they are probably best placed to respond to this. And those links already exist within Sussex Partnership Trust. We just need to make sure that the wider neighbourhood mental health team community, is able to follow the same process and protocol. But absolutely, the crisis teams will be engaged, and the neighbourhood mental health teams, the appropriate part, will support the inpatient work and discharge planning, and support people with relevant Mental Health Act assessments or discharge planning.
Thank you, Rob. That's really helpful. We've got a question here from Daisy around, I guess, kind of who will be able to make a referral into the neighbourhood mental health team. So are there specific professionals such as GPs or specific services that will be able to refer into these teams to be able to access that multidisciplinary team triage that we've described?
In my view, it should be open to a wide range of professionals, because we don't want to limit or restrict the access to people who may need support. And when a person is referred or signposted to the neighbourhood mental health team, this is where the triage, the multi-agency specialism and knowledge will discuss who is best placed to provide the support. Does the person require a physical health check? Does the person require more specialist secondary support from a crisis team or from an existing ATS? Or is indeed, would and I'm just using as an example, employee support specialist would be better placed to respond to the immediate need? And I'm just using it as an example. So I think the referral should be open from everyone. I do think though the GPs should be notified or made aware of those, because obviously the GPs and our primary care colleagues, they provide all other aspects of care and support around the patients. So I think there is a process for us to make sure the GP is always aware that a person was referred to a service or a team, because that's important for continuity of care. And that's not only related to the mental health, but also physical health on all the services. But the referral should be open to anyone. And again, Amanda, sorry, I keep referring to you, but I just want to make sure whether there's anything else you want to add. Oh, indeed, you want to correct me.
No, that's the ambition, is that they should be easy to get into. There won't be the gatekeeping, or and it will be a conversation. It won't be a form and a referral into another service, because you're already in the neighbourhood mental health team. You're in there, and once you're in there, then it's a conversation to find out where you need to go, not a referral onto this or referral to that. It's a conversation. And we hope that even in that conversation, if there are waiting lists or if people are not sure, then the team can work together to figure out what to do. Okay, there's a bit of a wait for this. Can anybody do this piece of work whilst they're waiting for that? Or can we support them whilst they're waiting? And the idea is very much of, we're not sending people anywhere, we're taking them to get the help they need. We're not sending them to a different service or a different person. We're taking them, and whilst we're taking them, they're our responsibility. We don't just pass them on. We stay with the person until we're confident that they've got the support and service that they need.
Thank you both. And also there is that ambition as well that we'll be able to introduce self-referrals as well into the neighbourhood teams, where somebody wouldn't necessarily have to go through a service or a professional to be able to refer to that service, that they would be able to refer themselves, as people can with other services such as NHS talking therapies, for example. So thank you both. That's really, really helpful. We've got another question here around kind of the escalation pathway. So if somebody is already being supported by a service, say for an example, the ATS, but they're not currently actually seeing the service very much. So, for example, if the member of staff that's supporting them is on like long-term sick, how can that then be escalated to the neighbourhood mental health team so that we can ensure that person is receiving support and input? They've said that in their experience, it's quite common that this happens among carers groups.
Thanks, and thanks for the question. I wonder whether this question specifically relates to more of the ATS part of the neighbourhood mental health team, as if I can describe it like that. I would hope that all patients on the caseloads are being followed up in line with their risk assessment and care plans. I would hope that happens. And when a lead practitioner or a key worker is on sick leave, annual leave, the rest of the team picks that up in line with the care plan. I think it's right to acknowledge that maybe sometimes that it doesn't happen, and due to a number of reasons, maybe vacancies or the demands. And I think at this point, I would really encourage the escalation directly to our ATS or duty worker, to the ATS part of the neighbourhood mental health team, to make sure we can respond to the immediate need. We also need to remember that if there's anyone in terms of the crisis, that they can always contact the support services in terms of the crisis so that we could provide immediate response. So there's the Sussex Mental Health line, there's the 111. In case of emergencies, obviously, there is the 999/A&E. But this is sort of in terms of emergency, I would really support that. If there's some specific examples around, there is a patient that is whose care plan is not being followed up, then Sharon, again, can you please let me know and we can look into this. But I would hope that all patients are being supported in line with the care plans and risk assessment. And indeed, if we need to review that, then absolutely we can do that through the ATS part of the neighbourhood mental health team.
Thank you, Rob. That's really helpful. There's another question here which I think follows on from what you've just described, but there is something I think is worth kind of pulling out of this question, in that how we'll manage kind of discharges from services, and monitoring and managing that people aren't kind of discharged from a service if I guess they're not ready to be, kind of, and without the kind of provision or support in place that they may need. So how is it going to work? Will people be discharged from a neighbourhood mental health team, or do they kind of stay under the team for a period of time? It might be helpful if we can kind of describe that, if possible. Thank you.
So I think it's a bit like Amanda said earlier. People are part of the neighbourhood mental health team already. They may get some specific interventions as part of the neighbourhood mental health team to respond to their needs. And I suspect it may happen, maybe they discharge or from a specific element of the neighbourhood team. So maybe it could be actually there's no longer need for a ATS, specialist secondary care support, but actually there would be what would be beneficial to have support from Time to Talk or from employee specialists or access facilitator. I'm just using it as a very broad example, and it may not be the right example, but just very broadly describing that. So I don't necessarily think people will be discharged from the neighbourhood mental health team. I think they may be at a point in time, specific intervention may be stopped because hopefully it led to an improvement, or it didn't work and another intervention needs to be implemented. I would think that all our discharges are being planned with patients and with the support network, whether it's their families and carers. And if that doesn't happen, I think in terms of I would be quite happy to look into specific cases, but we certainly from the Sussex partnership perspective, we wouldn't, and I don't want to be discharging people from our services without their involvement, their agreement, and agreement of the support network, carers or relatives. So generally happy to look into this, and that's certainly the intention for us. Amanda, again, I'm not sure if you want to add anything else.
Yeah, I'm not sure if any of you have seen the 3 circles diagram that we did to kind of demonstrate how the neighbourhood mental health teams would work. And they go from getting advice, information, getting support to getting more support. When people are getting more support, when that need ends, then they can move into getting support or advice and information. But if their need changes and they need to get back into the ATS part of the NMHT, it won't be as it has been to refer them back in. They're already in it, so it will just be a conversation saying, oh, this person, we thought they needed this, turns out they needed that, can we get them back in to see whoever they were seeing a month ago or whatever? And that's the way it should be working now.
Thank you both. That's great, and obviously that is the real aim, isn't it? So that people can continue to kind of access the support that they need, and we recognise that obviously that can change. So this model is more flexible than I think what we experience at the moment. So that's definitely the aim. I can't believe where the time has gone this afternoon. We've only got a few minutes left. I think I've covered all the questions that have come into the Q&A and the chat box. So what I'll do is I think I'll start to bring the session to a close this afternoon. So just to say thank you to everybody who's attended. I know this is a very busy time of year. So thank you for tuning in and for your questions and comments. Thank you to Amanda and Rob, obviously for supporting the session this afternoon. This is our last webinar of the year. But we will be back again in January, and our January webinar is going to be a similar kind of model to what we've done today, but it's going to be a focus on Brighton and Hove. So if you do kind of work in a role that is kind of across Sussex, or if you're interested in finding out what's happening in the other areas as well, then do sign up to attend that session. As we spoke about at the beginning of the session this afternoon, I will share a recording to the webinar, so please do share that with any colleagues or contacts who you think might be interested in finding out a bit more about these developments. And as we've also mentioned, there is a number of webinars that we run before. In the chat, I did put a link to the August webinar, which went into a bit more detail around the specific services that will be part of the kind of core neighbourhood mental health team. So I'll include a link to that within the email that I send round, as well as a link to the YouTube playlist. So do have a watch back of those if you do get a moment. But just to say, kind of,
you and your links, you poor soul. Having to take care of all of us non-stop, and I'm glad that's being recorded, because do know you're recognised.
Oh, thank you, Mel. That's very kind. But hopefully the links will be helpful. And obviously, as always, we have got our inbox there. So if there are other bits of information or resources that would be useful for us to be developing, do let us know, because we really want to make sure that people feel kind of supported and informed throughout this process. So yes, do get in touch with us if you do have any ideas or suggestions. And then lastly, just to say that I hope you have an enjoyable and restful festive period, and we look forward to seeing you all again in January, and I hope you have a good rest of the day. Thank you all so much.
Megan, go off and have some cake and coffee. God knows you've earned it. Happy Christmas, everyone.
Happy
Thank
Christmas.
you very much.
Christmas. Bye-bye.
Thank you. Bye-bye.
Bye.